Well, thank you very much. I'm Dr. Kevin Kavanagh and would like to talk to you today about science, pseudoscience, and the decline of public health. The central argument in this presentation is that there is a conflict between the evidence and standards of mainstream medical science and pseudoscience, which is setting the stage for the decline and possible demise of public health in the United States. The United States Department of Health and Human Services is currently challenging journals over the retraction of articles, along with exerting pressure to not publish vaccine studies. This has resulted in flawed anti-vaccine work being protected, while articles providing vaccine safety evidence are being blocked from publication. The stakes in these actions extend far beyond the academic debate to both public trust and health outcomes of our general population. An example of this was the attempt to prevent retraction of a study which was published in toxicology reports, which inferred a connection between vaccines and sudden infant death syndrome. The study used the VAERS database, and there were a number of methodological concerns which were thoroughly explained in an editorial by the journal's editor. The main reason that the study was removed was that it used VAERS, and VAERS is characterized in the editorial as being unsuitable by itself for determining causation. VAERS is built on passive reporting. Anybody can submit a case to VAERS, even a bot. The cases in VAERS only represent a signal which need to be investigated. Many signals which are detected in VAERS are investigated, and most reports to VAERS do not have a causal relationship. Another example was the department's attempt to promote the removal of a study which documented the safety of aluminum adjuvants in vaccines. This was a large Danish study which was conducted by the Statens Serum Institute and published in the Annals of Internal Medicine. The study involved over 1 million children in Denmark and evaluated 50 chronic conditions, including autism. What really disturbs me about this call for removal is that the basis of concern does not even appear to be plausible. A child's exposure to aluminum vaccines is much lower than exposure to everyday aluminum sources. We take trips in aluminum tubes. We drink carbonated acetic soda out of aluminum cans. We cook in aluminum pans. And the Earth's crust is 8% aluminum, which is the third most common element of the Earth's crust. And finally, the kidneys effectively remove aluminum from the human bloodstream. Thus, it is not even plausible that this is a problem, and why one would question the results of these findings is to me a sign of a lack of critical thinking. There have also been a number of examples of blocking publications of studies which demonstrated both safety and efficacy of vaccines. A case in point was the CDC's Morbidity and Mortality Monthly Report, which blocked a study which found the COVID-19 vaccines decreased the likelihood of hospitalizations and emergency department visits by almost half. The reason for not publishing was cited as methodological concerns. The study used a test-negative design among people evaluated for COVID-19-like respiratory illnesses. However, this design has been used for decades to evaluate vaccines. What this design is that it looks at a number of individuals who come into the emergency room or hospital that have symptoms that are reminiscent of COVID-19. These individuals are tested. Some have COVID-19 and some do not. Those two groups are then evaluated and subdivided into the proportion of individuals which have been vaccinated and not vaccinated. And the vaccination rates between these two groups are compared. Now, there are concerns that there may be biases. However, these biases can be in both directions. People who have vaccines may be more likely to show up for health care because they're more locked in or in tune to the healthcare system. But likewise, people with vaccines who develop COVID may be more likely to come into the system, the same as those individuals if they were to develop a respiratory infection for another illness. So there are biases in both directions. And as I previously stated, this design has been used for decades to monitor vaccine effectiveness. Kaiser Family Foundation has also reported on this issue and stated that a number of studies have found that the test negative design is highly consistent with randomized controlled trials. And finally, randomized controlled trials, especially in public health, are oftentimes unethical. There have also been a number of other studies, including those that involve the vaccine Shingrix for shingles, that have had their results blocked from publication. One COVID-19 study evaluated over 4 million vaccine recipients and found rare known adverse events. Another study evaluated 7.5 million Medicare recipients and found only a risk of severe allergic reactions at an incidence of approximately 1 in 1 million. And the Shingrix study, which reported safety data on that vaccine, was also not published. And ironically, at the same time, a study of Shingrix observed it helped prevent dementia. So why does all of this matter? Well, currently our society is faced with two paths to take. One involves vaccinations to prevent acute illnesses and to prevent long-term sequelae. The other is to suffer the consequences and to have an albatross around our society and our industrial potential. We need to remember that many viruses can persist after infection. So prevention matters not only today or during the acute illness, but to prevent diseases which may manifest themselves decades later. For example, 1 in 6 patients who develop COVID-19 may also develop long COVID. And long COVID is a major ongoing burden. In those afflicted, yearly healthcare costs are increased over 66%. The United States needs a comprehensive public health strategy, including vaccinations and respiratory preventive measures. There are also institutional consequences. Currently, scientists are leaving the field and scientists are leaving the United States. The United States is near losing its measles elimination status. We are abandoning an elimination strategy for emerging pathogens and replacing it with a mitigation strategy, thus responding to outbreaks as they occur rather than preventing outbreaks from occurring. In addition, we are undergoing a brain drain of our scientists to Europe, Canada, and other countries. I'd like you to consider 3 takeaways. First, data quality matters. Passive reports cannot prove causation alone. Second, publication integrity matters. Flawed and strong studies should face consistent standards and be made readily available to the public. And finally, public health consequences matter. Public confidence in vaccines, disease control, and scientific integrity are linked. Thank you very much for listening to this presentation, and I would like you to view the following presentation on vaccine mandates and military readiness, which really demonstrates the consequences of our failing public health care system and the vaccine misinformation which is permeating through our society. Thank you.